Okay, now we're live.
It's on there live.
Hi, I'm Dr. Craig Herre, and I'm a founding partner of the Texas Center for Occlusal Studies, now called the Stewart Center, and I'm here with my dental partner.
Live on Insta.
This is a new venue for us, although I like Instagram, but never been live on Instagram before. We're going to do a little question and answer for 15-20 minutes, just to give you some background information on the Stewart Center and why we started the Stewart Center back in 2014. And Dr. Tim was one of the very first graduates of the Student Center, or of the Stewart Center. So we'll ask him a few questions about his experiences there and what he's learned from that. So Tim, you want to go ahead and take it away?
Sure. So, I'll act as the interviewer, and so we'll start out by what prompted you and Dr. Stewart to found the Stewart Center. What was your kind of mission and kind of passion behind that project?
Well, I can speak to that because that was a period of time when we were searching for more. We had the good fortune of having training together in another occlusal discipline, and we had a very good background in how to work with TMD, but it didn't answer all of our questions. While we were having success treating patients with it, we knew there was more to it. And so we wanted to develop a program that basically closed all the loopholes and closed the circle so that we could have a program that answered the questions that we had, more in depth on TMJ anatomy, more in depth on the airway and the physiology of the airway and why it's important in dealing with TMD. And grant you, this was back in 2014, which is 5 years ago. And we had no idea what we were stumbling onto. At that point in time, the airway was something we knew of and paid some respects to, but we had no idea that it was going to end up being what it is today. And now it's really the major focus of what we're doing going forward.
So it sounds like part of the Stewart Center, and from the past to the present, is all about continuing your growth as a dentist and helping a dentist continue their journey on providing the best care for their patients. How is the Stewart Center, along with this curriculum, helping the dentists implement this into their practice and helping their practice grow as they learn this new knowledge that is really helping save lives?
Well, the two main missions, I think, of the Stewart Center at this point in time, and it's really been that way ever since we started, are basically for the doctor and for the patients. We always talk about the benefits of doing this occlusal treatment and the things that we're doing as something that is life-changing for the patient, and it also is life-changing for those dentists that go through. Most dentists have never had an experience doing complete dentistry. They may have taken some excellent courses at the Spear Center and been through some of the Pankey and Dawson courses and Coyce, but they've never had the ability to actually treat a patient from the start to the finish and carry it through completely. And when the residents go through our curriculum, they get all of the information they need and more to be able to take a simple or even relatively complicated patient who has occlusion, wear, symptoms, and airway issues, and have problems in those arenas, and they can treat those patients reliably and consistently. And we're finding that most of our residents, probably 90% of them, are actually using the information that they got and the education that they got at the Stewart Center daily in their practices. We get questions and we talk with them frequently, and they come down and audit the classes, and we know that they're experiencing some successes, and we've been able to help them through difficult cases and times when they do get themselves in a little bit of trouble.
Yeah, but I've experienced that firsthand, where over my first 10 years of being a dentist, not only having you as a mentor and learning this from the get-go, but the way the curriculum's taught at the Stewart Center, it's not just all picking up a book and studying anatomy and doing certain things, which are all important, but you teach more practical, hands-on skills that are easy to implement, because it can be a fairly complex process when you think about TMD, pain, airway, other health complications, growth and development. But you guys are able to distill down the information into teachable parts and aspects, which I think sets it apart from a lot of the other education I see. So kind of speak on that, like with, how do you guys handle all the hands-on components of treating the TMD and that aspect of it?
Well, no doubt the problems that the patients present with are extremely complex, and the diagnosis and treatment planning in this arena is much more complicated and much more difficult than it is doing traditional CO dentistry. When a student goes through our program, they have the luxury of having very experienced clinicians, both Dr. Hal Stewart and myself, and a couple of the other adjunct faculties that we have, as well as the excellent laboratory support. We've got some wonderful laboratory technologists that have been highly trained, and they work hand in hand, and they're a big, big part of the program. But we do not only teach hands-on, but we're there for the residents and the students. We're with them, mentoring them both in the curriculum and when they're home. They have the freedom and the luxury to give us a phone call, send us a text, an email, whatever it is. And so we present in a way that it's very packed. The curriculum is one that we've streamlined, but yet it is really full every time. We don't really have a lot of time to spare. So we're throwing a whole lot at them at one time, but we do it in a way that they can understand it. We give them some of the information that we teach. We've got a cloud file for them, so they have information they can always go back and look to.
Well, I think one of the nice things is, you and Dr. Stewart have, years of experience doing this, but probably more so than anybody else, teaching the bio-rejuvenation principles. And, they can be complex, they may seem easy, but when you take them back to your office, there's, when you're in the midst of your day-to-day, struggles anyway, there can be a lot of complexity to it. So what you said about being able to ask questions, handle phone calls, that takes a lot of time, but you guys go out of your way to, really help everybody. So I think that's another big thing that sets it apart. Small class sizes, ample learning ability, but then having mentors. I mean, you're not going to get anywhere with some of this process without having a good mentor, and the Stewart Center is set up, almost as just a mentorship process. Having somebody
that is really
that you can learn from, and it's the only way you're going to make it work.
That's a great way of putting it, Tim. And Hal and I both had our mentors, and we're mentoring our faculty now. And then some of the students, you bring up the small class size. That's absolutely true. We're fortunate, Hal and I, that we've had the opportunity to do these cases on patients for over 15 years apiece, going on 20. So we've had a lot of experience. I'd venture to say there's very few clinicians worldwide that have done more cases using this biorejuvenation technology and principles around the world. So we have a lot of experiences that we can share, both helping them troubleshoot as well as teaching them, how we do things day to day.
So where do you and Hal see the future of the Stewart Center? What's your guys' vision? What do you want to take? What do you think the next level of care you can provide with kind of education from there?
Well, we're really glad that we started this using minimally invasive techniques, and I see us going further into that arena of the minimally invasive. In other words, trying to resist doing as much cutting as we can on teeth, and we've accomplished a lot of that now, but I know we can go further. We're going to be utilizing digital technology at some point, where we'll be using scanning technology to get all of our model work and mountings virtually, and the laboratories are going to be working on computers and doing the waxing with computers, and then they'll probably fabricate for us some of the things that we place over the teeth made out of some sort of composite. So we know that right now we're using human hands and artistic talents of our laboratory technicians, and we're placing things by hand, but eventually technology will get into this arena. Also, airway has become such a big part of what we're doing, and we know that the airway really is the genesis of most TMD, And so as we learn more and more about it and are able to teach more, our curriculum is going to be very airway centric. And it's really important because the airway is, again, really the problem that creates the symptomatology that we see with patients who have TMD. We also like really the learning environment that we've created. We've got a very down-home atmosphere, the great staff. Dr. Stewart has his sister, who's our executive director, and his daughter, and they do just a fantastic job. They feed you really well. We like the small class sizes, and we like the way we're doing this. This is not for everybody, and we don't build the curriculum for the masses. This is just for specific, unique dentists that really want to try to practice in a manner where they do comprehensive care. And this is the type of dentistry that's not covered by insurance. And there's great opportunities here for dentists to evolve and become, a smaller practice where they do more complete dentistry, and hopefully they can find ways to get outside of the insurance arena as well.
So that sounds like the biggest benefit to the dentist. They're able to provide conservative treatment to the patient, to the principles you teach, where you don't have to mow down teeth, place crowns, you can use composite. But then you're also insulating your practice, for the future. And, it's, something you guys always say, to try to get outside of doing just dental school dentistry. And, just, you're not doing just your generic, quadrant composites or single unit, CEREC crowns, but, you're treating the whole health, whole body, whole person with this approach, but it's at a level elevated to where you can provide the best care. But it's something to where if not a lot of people are doing it in your neighborhood, you can become the go-to expert and the person that people seek out for TMD, airway growth and development, childhood issues. So I think that's the biggest benefit, for someone as a younger dentist or someone looking to differentiate themselves, or the principles you teach and what it can provide your practice, but your patients as well, because your patients buy into it. They want to be healthy, they understand wellness, and that's what you offer.
Yeah, there's no doubt about that. Quite a few of the referrals that we get in our practice actually come from our colleagues in dentistry, general dentists, certainly some specialists and such too. So this does separate you from the masses out there, and I think that's going to be more and more important in the future. If you look at the disease epidemiology out there now, there certainly is less caries in the educated population. There's certainly less periodontal disease, and I can remember in the late 1990s when I started getting trained in this, I was concerned about the future after the cosmetic boom kind of died off, and I was never in insurance, so I didn't have insurance to ever refer patients or however that works. So I asked a lot of questions in those days. I saw these people coming into my practice, and I didn't have the tools to be able to treat them. And I stumbled into some training that Hal also stumbled into, and it was the greatest thing that ever happened to us because it was the genesis of what we're doing now down in Texas. It gave us the opportunity to learn ourselves, and we have such passion for it that we've continued that. And really that's why we're here, is because we want to continue to perpetuate the gift that we've learned to people like you, Tim, who now are going to be the person that's going to carry that torch and even expand on it even more.
Well, I think that's part of the key is, when you differentiate and you seek out the knowledge, it's not taught in dental school. It's not taught most places. So like you just said, you feel good because you do have the answers for when someone comes in pain and you can help them, learning the principles of biorejuvenation dentistry and, what the Stewart Center it teaches, because people they want to be healthy and they want to be in that situation. So when you have the answers and you know what to look for, and other dentists know what they don't, that's like a black hole. Like, go see that person. And when you can do it yourself and take care of it and stuff, then it makes dentistry fun. You're not beating your head against the wall doing certain things, and day in, day out. Kind of unpacking these stories that these people have, their complicated past and where they're at, and when you can give them hope, then I think that's a fun thing.
Oh my gosh, it's like a Christmas present. When you see a new patient on your schedule that is desperate for help, and you look at their story that they tell you, and as I say, unpack that, when you can boil it all down and start to take a look at what's really going on here, and the fact that you actually have an answer for them is really humbling. It really is. So I've been very fortunate in that I was able to take Tim with me when he was in dental school. So he's learned this from the ground floor. He's never really known another way to practice. So he's really lucky that he's got the passion and fire for this after being out for 10 years, and now he's really taken that torch and running with it. And what do you think, Tim, is the thing that you take away the most from your experience at the Stewart Center? Because Tim was actually one of a really amazing class we had for our very first one back in 2014. So what do you, yeah, it's been that long, believe it or not. So think of something that you, as a student and not my son, took away from that.
Well, I think number one is when you learn this information and you see what to look for, you can't unsee it, because you go back to your office and every single person, by and large, 8 out of 10, 9 out of 10 people you see in your hygiene chair every day, within your chair as a new patient, have some of these issues. And once you start to look at it and you know what's going on, then it's fun because you have a solution. You can provide them if they're having pain or issues, or you can start to talk to them about areas within their mouth that are signs that maybe they have sleep apnea, and you can help get them healthy again and all that and stuff. But once you learn that, I mean, that's one thing, but then when you learn from people who have experience and have done cases that go well, cases that haven't gone so well, and continue to evolve their techniques and their process and don't stay complacent, and you're learning that hands-on portion of it, that makes all the difference in the world, is having somebody that actually utilizes the technology and the treatment to make it successful. And you don't need to rewrite the book. Follow somebody who has success, and that's all you're doing when you become a resident there.
And then eventually it becomes your job to take it.
Then
you be the mentor then, and
then you take it and pass it to your colleagues and friends
down, right.
and all that and stuff. And it's kind of the gift that keeps on giving when you learn that.
Well, let's close with one more question for you. I know there's a lot of dentists out there that are, maybe have questions about, what should they ever consider something like this. And what would you say to those dentists, that are contemplating, getting involved with us down in the Texas Center?
I would just ask what your visions and goals are, for the future. I mean, do you want to treat health? Do you want to, like you said, insulate yourself from, maybe insurance, or, maybe potential DSOs, or, that nature, the ever-evolving landscape within dentistry. But then also, with the way dentistry is, we're taught to, just treat the disease, patch teeth that are breaking down. And, if you're fine with that, if you're happy, just a tooth comes in and breaks, fix it, put a crown on it, if that's the dentistry for you, then that's perfectly fine. But, if you want to, evolve and take your practice to the next level, provide true health care, true wellness to the patients that are seeking it and that deserve it. And, then I think that's something, that you owe to your patients in your practice, and even yourself. If you want to keep yourself healthy, long term, then this is a good way to protect yourself too.
Really good point.
Yeah.
Yeah. Well, this has been a lot of fun. I've enjoyed being live with you. We're live in Leawood, Kansas, by the way.
Not Texas.
It is not Texas. It's Leawood, Kansas. But we're here.
So how, if people have, people watching this, or, if they see this down the road, how can they find more information about the Texas Center? How can they reach out to you guys? What's the method, protocol?
Well, absolutely. The best ways, through the web, thestewartcenter.com, and through that you can get the phone number. You can call Kathy Stewart directly. You can get a hold of Hal Stewart or myself. You can Google our website or Hal Stewart's website, and you should be able to find us.
I know you guys are in the midst of you got a current class going on now, but when do you see the next class start?
That's a good question.
People want to get involved.
We're going to be completing this class in November, and then we're looking at having another airway symposium, probably going to be in December or January next year. And our first class in 2019 will be starting, I believe, in March or April. So it's going to be a little over a year from now, but that gives you a lot of time to get prepared and maybe do some background study. And if you want some materials to read or different things, if you are interested in next year, we'll certainly be happy to help you with that. Yeah,
I think even if you just want info, the Airway Symposium, I wish I could have gone to that last year, but was on my honeymoon. I was bummed about that.
And it was good.
It was fun.
It was amazing.
But yeah, any other, you guys do informational sessions all the time. But that's the thing, airway, kids, growth and development. I mean, that's the future with all this. If you can get in, learn these principles, and save your own kids, but then prevent kids from being the adult TMD, adult sleep apnea airway patient, that's where it's at. And when you learn that, I mean, that's, to me, the life-changing part of it. So come to the airway seminar and reach out, find more info and stuff. It definitely is life-changing and all that.
All right. Thank you, everybody. Have a good evening. Okay, now we have to hit save. Do we have to hit end?